It was a great honor to be part of the ARAMIS trial, one of three nmCRPC trials that really changed the landscape for patients who we identify as having an nmCRPC, castrate level of testosterone after being on a duration of androgen deprivation therapy and a rising PSA, and no imaging positivity based upon conventional imaging or what we refer to as CT scan and bone scan. And in this, a 2-to-1 randomization, we saw that patients on ARAMIS versus placebo not only clearly met the primary endpoint of metastasis-free survival, and then later on the secondary endpoint of overall survival, clearly demonstrating its efficacy. But we had to ask the question, well, you're starting a typically elderly patient population on medication when they're ostensibly asymptomatic, albeit they have some side effects of T suppression. And what we found was in our study of ARAMIS, darolutamide, 2 pills taken twice daily, was that the adverse events of interest that we had previously seen with other androgen receptor pathway inhibitors was not anywhere near as significant, and particularly as it related to falls, fractures, hypertension, rash, cognitive impairment, fatigue. So I think this was, borne out in our extended follow-up, and that's what we presented now at ASCO 2021. Additionally, there's other data where the DDI, or the drug-drug interactions, are more favorable with darolutamide. So the overall discontinuation rate throughout the entirety of the trial was matched in comparison to both placebo and the therapeutic arm of darolutamide. Approximately 90% of patients continued throughout their full course of therapy. Of course, patients with darolutamide stayed on drug much longer than the placebo. So I think the take home, frankly, is that we want drugs that are efficacious with our advanced prostate cancer patients, prolonging survival and reducing disease progression, but at the same time, avoiding complications of therapy and preserving quality of life.